Knock, knock. Hello, Mr. Jones. My name is Mariyama. I am here to do your physical exam today. May I have a seat?
Sure.
Thank you. I understand the purpose of your visit today is to follow up on your blood pressure.
Yes.
Do you have any other issues you would like to address today?
Besides my blood pressure, I have some swelling in my feet.
When did the swelling start?
About 2 months ago.
How often is the swelling?
It's on and off.
On and off. When does the swelling happen? Does it happen at rest, with activities, after activities?
I usually notice it after I've been standing for a long period of time.
What do you do to relieve the swelling?
I usually elevate my feet at the end of the day.
Do you take any medications
No.
to help the swelling?
No.
No? Okay. Are you allergic to any drugs, or do you have any drug allergies?
No.
Are you allergic to any food or food allergies?
No.
What about latex?
No.
No? Do you take any medications that includes the over-counter medications like Tylenol or multivitamins?
I take Norvasc 10 milligrams. I've taken that's for my blood pressure, and I take it daily.
Do you take it regularly?
Yes.
How long have you been taking Norvasc?
5 years.
5 years. Okay. All right. Do you have any, I would say, any pertinent medical history that you want to tell me about, or can you tell me about?
I did have a history of chest pains. I went to the cardiologist, and I remember them saying that everything checked out.
Now, do you have any family members, like your parents or your siblings, that have a history of any heart condition, lung conditions, or perhaps even been diagnosed with diabetes?
Yes, my parents and my grandparents live in Tampa. My father, he had a stroke when he was 60. He's 76 now. He's okay now, but he did have some rehabilitation when he had his stroke. My mother, she's 75. She has high blood pressure and diabetes. And my older brother, besides his drinking, he does have high blood pressure and diabetes also.
Okay. Thank you. Do you work?
Yes, I do.
What do you do?
I'm a crane operator at a local construction company.
Do you smoke?
I used to. Between the ages of 21 and 35, I used to smoke half a pack of cigarettes a day. But I stopped after 2 tries.
Oh, that's very good. Do you drink alcohol, like beer or wine or anything like that?
Yes, I do about 6 to 7 beers on the weekend.
On the weekend? Do you think that you will need to cut down?
No, there's nothing to cut down.
Have you been criticized about your drinking?
Yes.
Are you annoyed about people criticizing you?
Yes.
Okay. Do you need to drink alcohol, let's say the day after you had a binge? Do you need to drink an alcoholic beverage when you wake up in the morning to relieve jitteriness or a hangover?
No.
No? Okay. Are you married?
Yes, I am.
How long have you been married?
I'm with my wife for 30 years. We have 2 children together. She's very supportive. Right now she's a little aggravated with me hanging out with my brother too much.
Okay. Have you ever traveled outside of the United States
No.
recently? How is your sleeping?
I don't sleep very well these days. I sleep about 6 hours a night. I am sleeping. I do fall asleep right when I go to bed, but I don't stay asleep, and when I wake up, I don't feel very rested.
Okay. Do you have any religious practices or spirituality?
Yes, we are Christian. We used to go to church regularly, but we don't anymore.
Okay.
Recently, I've been praying for my family.
Do you have a regular doctor?
I know I do.
All right. What about your immunizations? Are you up to date on your immunizations?
I'm not really sure.
I'm not sure. What about a dental? Have you had perhaps a dental or eye exam recently?
No, I'm not sure my last one.
What was your last physical exam?
I'm not sure about that either.
Okay. All right. You told me briefly about your chest pain, that you had chest pain and you went to the cardiologist 5 years ago. Now, do you have to sleep with a lot of pillows at night?
Yes.
Do you sweat at night?
No.
Do you have any shortness of breath at rest or with activities?
Yes.
Okay. Do you have any allergies, just common allergies, or?
Yes, I do have seasonal allergies.
Do you Or are you exposed to any irritants at work, since you told me that you work at a construction site as a crane operator. Do you are exposed to any of that?
Yes, there's a lot of dust and debris at the construction sites.
As a child, do you remember or can you remember having any history of frequent respiratory infections?
No.
Do you have a history of any muscle injuries, bone injuries, or joint?
It's about 10 years ago. I had a back injury from work.
Mm-hmm.
I did have to go to some physical therapy for that,
Mm-hmm.
but it's okay now.
Now, do you have any pain related to that back injury?
Yes, sometimes occasionally.
Can you rate that pain on a scale of 0 to 10 when it is occurring?
About 2.
A 2? Okay, so that's not that bad. Okay. Does any of your family members, like your parents or your siblings, have a history of bone, joint, or muscle problems?
No.
No? Okay. Well, thank you for your patience with the questions I had to ask you today. But I need to do a physical examination on you. I just need to step over here and wash my hands and get my equipment, and I'll be right back. I'll knock on the door again. Okay? Thank you. Hi, Mr. Jones. I'm back to do your assessment or your physical exam. Mr. Jones, I'll be taking your blood pressure first. Just keep your arm relaxed for me. I would like to check your pulse, see if I can have your wrist here. Thank you. Thank you. I will need to get a temperature or oral temperature. And I can just place this under your tongue. Thank you. Thank you. Next, Mr. Jones, I would like you to stand up for me. Thank you, sir. I would like to measure your waist if you don't mind. I'm just going to put it right here. I'm going to step behind you. Thank you. Back in front of you. Thank you. Thank you, sir. And that completes our assessment and physical exam today. I thank you for your patience and help with the assessment. If you need anything or have any questions about today's exam, feel free to follow up with the office. And if you want a copy of your records, feel free to ask for those too. But until then, have a wonderful day, and thank you for coming in.